In the previous video, I gave you introduction about how Taiwanese government and its people united together in fighting against the coronavirus. In this video, I would like to analyze some important numbers about the coronavirus. First, I will give you a fake sample of 1,000 people who may be infected with this coronavirus, and how we can know if one is infected and how modern medical tests actually tell a patient whether they have a certain disease. You will learn that there is no test that can be 100% accurate. And later you will learn the sad news about how inaccurate the current test for coronavirus is. The second section of this video is covering the current test of coronavirus and some new development of the rapid test. The good news is that Academia Sinica, the most prominent academic institution of Taiwan, has announced that a new rapid test method has successfully proved to be effective to detect the elusive coronavirus. In the third section, we will deal with some numbers of the coronavirus, which include the infected rate and the fatality rate. At the end, you will realize that one key of winning this war against the coronavirus is on the development of the large-scale, quick turnaround time testing kits that have to be cheap. You will see the timestamp of this video in the video description, where all news and data resources cited in this video will be also provided. First, in this tableau story, you will see that on a two-dimensional plane, there's a population of 1,000 people that some of them have coronavirus. Note that this 2D space does not imply the physical location, but you can perceive it as our interaction with people around us. Also, this is not showing the dynamic infection but a static situation. There will be some people who are lucky and not close to any coronavirus carrier at the lower left corner. But there are also some people who are coronavirus carriers or are not lucky enough and are close to those carriers, which is shown more in the top right corner. In story 1, you can easily see people who are infected and who are not. But in reality, without any medical test, we will not be able to know who is infected and who is not. The test is shown in the story 2, and we assume all people get tested. Normally, a medical test is measuring a patient's test sample based on a certain criterion, no matter it's the number of the certain pathogen or a certain component of the blood protein. And we will determine the test results as positive or negative based on whether it is above or below a threshold. This threshold is like a red line in the story 2. However, there are plenty of factors that will make the test inaccurate, which include the patient may not follow the diet instruction, the spot being sample may not have enough virus, or the tube may have been contaminated, or the testing SOP is not strictly followed by the technician. All of these factors can make the test result inaccurate. So as a result, when the test results return like in story 3, we will have some people who are carriers but not detected. Those are like a big cross. And some people who are healthy but being tested positive, and which is not easy to spot in the story 3, but we will see that in story 4. Given the current 2 dimensions, we cannot find an easy threshold that can easily and clearly separate the virus carriers and healthy people. This also implies that there might be extra dimensions that can help to better detect the virus, but we don't know now and may be discovered in the future. Now we see in story 4 that there are 3 groups to be shown in 3 colors. The accurate group in blue are those who are carrier tested positive and those healthy people who are tested negative. Those virus carrier tested negative are now shown in a big orange color cross. We call this group false negative. If you only choose those false positive to be shown in this filter, and you will see they are the small red points. In this example, we have a 79 false negative and 61 false positive. In the coronavirus example, the false negative example might be more damaging to the society, since people will continue interacting with them without proper preventions. The damage of false positive might more be at the individual level. Those false positive people will experience unnecessary treatment and quarantines. They may also lose friends and support, feel depressed and helpless. The above four stories are examples of 100 population tested. In reality, that is almost impossible. The number of coronavirus test kits is limited, and it will take a very long time to have all people tested. In story 5, we will show you a scenario that only 20% of its population is tested. You will find out that the blue big circle, which means those who are carriers and test positive, is only the tip of the iceberg. When the testing is limited, we will worry not only those big orange circles who are false negative, but also those large gray triangle, which mean the people who are virus carrier but not tested at all. Continuing interacting with these two groups without proper protections will keep the coronavirus spreading going on and on to the healthy group. So you see the importance of a large scale of tests conducted when the society encounter with this type of virus. Next, let's talk about coronavirus test. Coronavirus has been with us for a long time before this new coronavirus, and we have known 6 strains of coronavirus. This new strain found in Wuhan, China is named as nCoV 2019 or COVID-19. However, when I talk about coronavirus in this video, it's all referring to nCoV 2019. As we all know now, the toughest part of this coronavirus is its mild symptom or asymptomatic in some carriers. And it is extremely contagious, which can be infected through the droplet of saliva or mucus carried in the air for up to 6 feet. When an infected person coughs or sneezes, and also by touching the surface that is contaminated by the coronavirus. According to one study, coronavirus can remain infectious on inanimate surface for up to 9 days at a room temperature. The life of the virus on the surface also depends on the type of surface. Once you are infected by the coronavirus, the incubation period of the coronavirus is estimated to be 3 to 14 days. However, this range is still a guess, and there's always outliers for some carriers. There are several ways a lab can get a sample from the patient for testing. First is a special swab that takes sample from your nose or throat. Number 2 is a nasal aspirate, which injects a saline solution into your nose and then remove the sample with gentle suctions. The third type, tracheal aspirate, which is a thin lighted tube inserted down to your mouth and into your lung to collect samples. The fourth type is the sputum test from a thick mucus that are coughed up from the lung. And the last type is a blood test. From an HBR article, it says, currently most pandemic-prone diseases, including coronavirus, are diagnosed by the polymerase chain reaction, or PCR. And this technique requires special laboratory machines and highly trained technicians. In early weeks, there are reports saying a patient in the U.S. was scared by out-of-own-pocket costs when he asked to have a coronavirus test. That was the reason some tourists from the Diamond Princess cruise ship chose to stay in Japan to have a test done. And later, the U.S. CDC has announced they will not build a coronavirus test. When the testing kit is limited, this type of free test may not be requested by the patient, but can only be authorized by the doctors. The second issue about testing is availability. At the current status, USA Today has a report on March 6th. It says there are 75,000 virus test kits in the US, and there are 69 local and state public health labs that cover 46 states, including Washington, D.C., with 5 states having their lab waiting to be verified. It also says when all the selected labs has been verified, it will be 100 local and state public health lab testing with a potential testing capacity of 10,000 tests per day. We should be aware about the speed of having test results returned also. Not just the testing lab need to have a qualified equipment, The speed of the test, which we call it test turnaround time, is also critical in the virus containment. The faster you can return the test result, the more tests can be done as long as we have enough testing kits. In Taiwan, on February 24th, the Kunyang Laboratory in Taipei designed a faster testing that can reduce the turnaround time from 1 day to just 4 hours. It not only increased the testing capacity by 6 times, it also helped to release more than 1,000 tourists in the local cruise ship, which are quarantined due to a suspicious case. When the coronavirus is spreading, a quick turnaround time of tests will reduce its spreading speed. Today, on March 8, Academia Sinica in Taiwan announced that they have developed a new rapid coronavirus test, which would take only 15 minutes of turnaround time. The next step of this new method is to have a clinical trial to Taiwanese patients and then to find manufacturers that can quickly mass produce these new testing kits. Kunyang Lab and Academia Sinica's new testing techniques are examples of process improvement. There are several new testing kits in many labs in different countries are also under development. In one report about the U.S. current situation, it says, the U.S. FDA has approved more widespread use of a rapid test for COVID-19. The test, which was developed by the CDC, uses samples from the nose, throat, and lungs. It enables fast, accurate diagnosis of the virus. The test is now allowed to be used at any CDC-approved lab across the country. However, it's not clear when the new rapid test will be available across the U.S. One thing is for sure, the first new testing kit that can be conducted in a large scale, fast turnaround time, and at a low cost will be the most anticipated now for the world. Before a large-scale and rapid coronavirus test can be done, we should be aware of our current testing in various countries. According to a blog on the worldmeters.info, it summarizes a table on the criteria and number of coronavirus testing made by several countries. The statistic is collected on March 2nd, but I also added 2 countries, Japan and Taiwan. In addition, I added a column of confirmed cases on March 6th, which is obtained from Johns Hopkins University. In this table, you will see South Korea has the highest test per million people, which is 2,138 people. South Korea has done the greatest number of tests, and thus South Korea also has the highest confirmed cases outside of China. Some people commented that the reason that South Korea's healthcare system is now under tremendous stress is because many confirmed patients inundated into the hospital. In contrast, Japan and the US are 2 countries that their tests per million people numbers are very low. By March 2nd, the US only has 1.4 tests per million and Japan has only 6.4 tests per million by March 4th. Different from South Korea that may did too many tests, too few tests can also be problematic. Out of Japan's 8,111 tests on March 4th, they have 461 confirmed cases on March 7th. And out of the US 432 tests by March 2nd, US had 401 confirmed cases on March 7th. Note that after US blocking Chinese travelers with 14 days of window staying in another country, Japan still continued to receive Chinese tourists. And while the US is blocking Chinese travelers with 14 days of window and force them to stay in another country, the US still did not block travelers from Japan, South Korea, Italy, or Iran before their large-scale outbreak in the recent week. Thus, by comparing with other countries, we can infer that the actual number of coronavirus carriers in the US and Japan should be much higher than the confirmed cases released. This reality check can only be confirmed when a large scale of tests being conducted in these 2 countries. Next, let's talk about the several numbers related to coronavirus. The Excel table you see here is made by Taiwanese CDC using a statistic on March 6th. In the Excel, you can see that South Korea has the highest infected number per 100,000 people, which is 12.18, and it is even higher than the number in China. While the US has the lowest infected per 100,000 people at a 0.07. But remember what we just discussed. The more tests you conduct, the more confirmed cases you will get. So South Korea has 1,500 times more tests per 100,000 people than the US. So if the US infected rate times 1,500, then its infected rate per 100,000 people will become 97. Of course, the US may not have a situation of secretive church like in South Korea. So if we even divide 97 by a factor of 20, the US will still have the infected rate of 4.88. And this number is only slightly lower than Italy and Iran and can be still very scary. Note that this is just me manipulating with multiplier and it's not a fact. But it may tell the audience the potential risk that American people are facing now. The faster we have more coronavirus tests done, the less guessing the audience need to do. The second number that people care most should be the fatality rate. WHO has published recently that the estimated fatality rate of the coronavirus is 3.4%. There are two fatality rates. The first fatality rate is the fatality rate per 100,000 people, which is the variable E in Excel. The denominator of this number is all healthy and infected people, meaning in every 100,000 citizens, how many people will die from this coronavirus. Another fatality number is death rate if infected, represented by variable F in the Excel. Its denominator is those people who are infected by this coronavirus. Our table has an overall death rate of 3.5, which is similar to that WHO just released. We should be aware that the 3.5 death rate, if infected, is an average number. What matters to us most is how we actually interpret it. This number is definitely much higher than the flu we encounter every year, which is seen as around 0.1% in average. Thus, we should be more scared for its death rate since it's around 30 times higher than a regular flu. This number also is influenced by many other factors. First is its numerator and denominator. As we find out, is it related to the number of confirmed cases and also how many tests a country actually has done. So a large-scale test will eventually give us a better view on this virus deadliness. Second, the death rate is also related to the medical resource a country has. We all know Iran's health system is shaky over years of sanction, but the stress on the country's medical resource is not only related to its overall medical resource before the coronavirus, it's also related to the speed of its outbreak. The outbreak of South Korea and Italy both prove that their medical system and availability of doctors and nurses are at the brink of a collapse. When the collapse started to appear, we can also expect the death rate will increase because some seriously ill patients will not be able to get the resources they need. In addition to actual numbers, we should also know the psychological perception of those numbers. Is 3.5% death rate high or not? We know regular flu that kills 0.1% of its infected patients, and it kills way more people than many other pandemics. But we live with it without any panic. We will not cancel our travel or quit dining out with flu's 0.1% death rate. Then what is the difference between the flu and the coronavirus? It's about the unknown and the uncertainty. 6 weeks ago, when China announced Wuhan quarantine, very few people in the West will foresee this coronavirus will reach to our doorstep so quickly. In the epidemiology, there's a RO number, or you call it R0 number, or basic reproductive rate that we should know. R0 number is the expected number of cases directly infected by one carrier in the population. From Wikipedia, this coronavirus R0 number is estimated between 1.4 and 3.8. Assume this number range is accurate, then the coronavirus is not the highest compared to other airborne disease. Then why is this coronavirus so scary? It is because around 50% of its infected patients have very mild or indistinctive symptoms or are asymptomatic. When this virus is hard to detect by its symptoms and has a high false negative in the test due to immature testing method, then an unknown number between 1.4 to 3.8 means this coronavirus will spread to many people before it can be contained. And this is exactly what just happened in our world in the last 6 weeks, all because this coronavirus spread without our detection, compounded with its 20 to 30 times much higher death rate than the regular flu. That is why this coronavirus makes us stop visiting our family and canceling our trip and make us staying home. At the end, please remember that the numbers we provide here are changing every day because this virus is so new and so much of it is unknown. However, knowing how each number is calculated, how a country conducts on patients, and how many tests are conducted, and the test accuracy, etc., will all help us to understand what number really means. WHO has made several corrections of their assessment on this virus in just several weeks. Now the development in the world has proved how wrong their early assessments were. The biggest problem with this coronavirus is fast spreading speed without detection. Facing this virus, if we have numbers wrong and corrected several days after, it may cause you to make a wrong decision about your travel plan, your purchase of food and medical supply, and maybe your life saving in the stock market. Its potential downside should not be ignored. God bless everyone.